My name is Dr. Heather Moore. I'm owner of Total Performance Physical Therapy. Tonight we're going to talk about 3 things you can do when your feet fall asleep. So now more so than ever, most of us are finding ourselves sitting a little bit more, not moving around as much, not really having a reason to move around as much. So a lot of time your legs will fall asleep, your feet will fall asleep. They'll go to stand up and it'll have a lot of pins and needles. So a couple things you can do while you're sitting to prevent that. So not really an exercise, but the first thing that we're going to do, and then I'll show you 3 exercises, is you shouldn't sit that long to actually have anything fall asleep. So obviously on an airplane, not many people are traveling right now, but if you are on an airplane or some confined situation, that's when you would expect your foot to fall asleep. But if you are at home and your feet are falling asleep, you want to make sure that you're actually standing up. You just want to move around. You don't have to do a long walk. But you don't want to sit for more than 15-20 minutes before you're up and moving around. I don't care if it's just to go to the bathroom. I don't care if you just stand up for a minute and then sit back down. Something to get that blood flowing, something to allow those nerves to be decompressed if they need to be, something to allow that back to loosen up. So it's really important, especially now when we lose track of time, when we binge watch TV. We want to make sure that we are getting up, whether you set a timer on your phone or you just kind of consciously think about it. It's super important to stand up. I'm getting a lot of complaints, a lot of people texting and emailing saying my back's really stiff or sore. So really make sure that you are making a conscious effort to get up. You're not used to sitting that much. Nobody is. I think I just saw reports that they've tracked activity down lower than 50%. More than normal, so it's really important that you keep moving during this time, even though it's the last thing you want to do. But what can you do while you are sitting? If you find yourself sitting, or you find yourself with a leg that has pins and needles in it, what can you do to kind of help that blood flow? So the first thing you're going to do is you're just going to kind of tap your heels. So we call ankle pumps. I'm just going to turn to the sides and show you. You can also tap your toes, okay? But this is going to allow blood to flow into those calves, into the legs, push that blood upward. Just get some of that moving. If there's a nerve that might be entrapped or causing some of that numbness and tingling, that'll help open it up. But you're just going to kind of tap your toes and lift up. It's more important that you lift up to get those big muscles in the back flowing, so you're able to push some of that blood up back towards your heart. But that's a really important one to do. The next one you want to do is you're going to sit with your ankle crossed over your knee, and you just want to lean forward. This is you're going to feel in your hip, in your butt, in your glute, in the back of your leg, your hamstring. Sit up nice and tall, lean forward. That's going to help everything just stretch. It's going to help everything open up. It's really important that you're going to find that as you sit more and more, your hips are going to get tighter, and you probably are going to wind up with your leg up here as opposed to it being open. So you want to make sure you drop your knee nice and comfortably, sit up nice and tall, and you're going to feel that stretch. If your leg is here and that's all you can do, fine. Ideally though, you want to sit up nice and straight and then lean forward. This is not okay. You don't want to bend forward from the waist and kind of crouch into that position. You want to sit up nice and tall, and then again, you want to switch it. You want to hold each side about 30 seconds and then switch back and forth. Do about 6 of those. That's an easy stretch to do. You can do it when you're laying down. You can just grab this through your legs and then do a figure 4 if you're laying down and wind up with your feet falling asleep. And then the final thing you want to do is you just want to just kind of grab your knee. You can march if you want, okay? Kind of shake your leg out, do a little bit of this, but anything that allows that blood and those muscles to flow. So just kind of a nice, easy march with a knee grab, all right? And then maybe just kind of a couple knee extensions. But anything like this, all right, that allows those muscles to contract, allows the blood to flow, allows the nerves to loosen up, will allow you to not have that foot fall asleep when you're sitting down. If you are experiencing pain or numbness or tingling and you want a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898 and we'll be sure to get you in. Thanks and have a good night.